One of the potential risks for a portable chest x-ray being underpenetrated or underexposed is having difficulty determining if the patient has fake bilateral pneumonia or potentially even pulmonary edema. Yeah, you don't want to make that mistake, okay? So the question for you is, can you recognize either extreme of exposure and what it can do to your interpretation of the chest x-ray? In this video on chest x-ray exposure, I'm going to show you a simple chest x-ray quality check to decide fast if your chest x-ray exposure and penetration are adequate. Hey guys, I'm Dr. Busti and welcome to another topic review at This Is Why, a show that helps healthcare professionals transform their medical knowledge from not just knowing the what or facts, but the understanding of the why, so that what we do in patient care makes sense and you don't have to memorize it all the time, okay? And with that, let's go ahead and get started. So let's ask the first and most obvious question. What do I mean by exposure on a chest x-ray? Well, exposure in practice is how many x-rays reach the detector. That's the plate, whether it's in front of the patient or behind them and behind the whatever part of the body you're imaging. Said another way, okay, is how penetrated is the film and the way it looks. On a chest x-ray, we judge this visually as penetration. Can we see enough detail through the mediastinum and the heart, but also not so much that everything turns dark and washed out? I'm going to walk into some images here, but for those of you listening on our podcast channels, I will walk you through the images as close as I can. But if you need to see those images, please check out the video on your YouTube channel or at thisiswhy.health. So what you see in these three quick x-rays here are differences of exposure and penetration. On the far left, okay, this is typically a normal exposure. Now, yes, certain things like the patient's body size, habitus, the thickness of the tissue will correspond and influence that at some level. But in general, that image on the far left is normal. This particular image is underexposed, and what sometimes happens is you don't see enough of the landmarks, right? And we're gonna walk through what those are here in a minute. And then over here on the far right is overexposed. You see a lot of black, right? And it looks clear. That's not helpful in looking for specific margins, okay? So I wanted to have that framework of what the three main types look like, okay? Now, this becomes very relevant in the context of a mnemonic that we use to assess if the chest x-ray image that you're looking at is of appropriate quality. And that's the mnemonic that I use in clinical practice, known as RIPE, R-I-P-E, okay? Now, we have this chart, which you can download at thisiswhy.health for free, okay, if you need it for studying or you want to share with other learners or you use it for your own presentations. But R, I, P, and E. Look at E. E, part of it is exposure, okay? So again, is it over or under exposed, or the penetration, is it appropriate to identify the key landmarks that we're looking for? Why does this matter? Because it ties into the other mnemonic that I also advocate and use and lecture on, okay, in our other topics that we offer, the A through I mnemonic, right? So A is that the image is adequate, and that's what RIPE feeds into. And so your exposure here, which is why we're talking about it, has relevance to the application of these two mnemonics if you use them in your own clinical practice. I use them so that I take a systematic approach to the evaluation of a chest x-ray, okay? Now, even in a digital era that we live in, right, we still need appropriate exposure to have an optimal contrast and avoid unnecessary radiation doses, okay? Okay, so let's now dive into some of the things that you can look at to help you to determine adequate exposure, okay? Now, you again have seen these. We have the normal on the left, underexposed in the middle, and exposed on the far right. Remember, on the overexposed, there's too much black, there's too much darkness. On the underexposed, we're not seeing enough of the thing. So how do we, when we look at these and we compare them to the normal, I think it's good to do that cross comparison, right? So that you can see what's the effect of not enough x-rays and too much x-ray or radiation exposure, okay? You should see thoracic vertebral bodies, okay, faintly through the cardiac silhouette. So again, here's our cardiac silhouette here, right? And so through here, you can see the vertebral bodies are noticeable through that. Now it does extend down through the diaphragm and even into the abdomen. You can see that. Typically that doesn't happen because most people have abdominal tissue that interferes with that. So you don't want to expose this area just to see it for nothing. We don't care if we're doing that for a chest x-ray. So you only want enough penetration through the thoracic cavity and through the heart, okay? Now when you look at the underexposed, I can't see that. It's missing, right? It's very difficult to see. There's not enough x-rays and radiation making it to the detector plate in order for those finer details to be present. And it's certainly much harder to see in the abdomen here. When you look at the overexposed, you can see the vertebral bodies. Again, this patient probably has a different body habitus, tissue penetration, those kind of things. But you can see the even the ribs and their attachments to the vertebral body are very clear, okay? But it's associated with all of this very dark looking areas of the lung fields, okay? So what happens if the chest x-ray is underexposed or underpenetrated? Well, first, the cardiac silhouette and the mediastinum just looks too solid white. I mean, that's obvious here. You can see how solid white that is, okay? The vertebral bodies are not as visible behind the heart. Again, you can see that that's the case here. Now, the lungs overall can sometimes look more opaque or wider than is expected. That's not jumping off the page here on this particular image, but what you'll start to see is more noticeable vasculature markings and things like that that may cause you, again, to think that something is there, okay? What about if the chest x-ray is overexposed or overpenetrated, right? Again, you see that the film is very dark, and the lung fields look very dark. You may be able to see sometimes the vertebral bodies even clearer than even on a normal. Again, it depends on the body habitus, but it will extend even down into the abdomen, almost like on the normal here, right? You may say, like, well, what's it? Again, this patient over here, you can see that the soft tissue is very little. There's not much padding there, if you will, okay? Now, in general, one of the take-home points is that the spine, especially that thoracic spine, you want to see it through the heart, but not always going into that abdomen, again, because of that tissue penetration. So we don't want to expose the patient to more radiation just to see the thoracic bodies inside the abdomen, okay? The second factor in how to determine adequate exposure is to check the lung markings and the diaphragms themselves, okay? You should be able to see the pulmonary vasculature permeating through the lung fields. So you can see that on the normal pretty easily, that scatters all the way out, okay? You can see them over here too. They're pretty noticeable here under the underexposed. But when you get to the overexposed, not only are the angles lost, costocardiac and costophrenic angles get a little bit blunted and blurred, they're just being washed out too much because there's so much black. But you also don't see the vascular markings, almost as if somebody had like a pneumothorax, right? Which we certainly don't want to have there. So when you look at the costophrenic angles, these are very sharp and clear. Again, on the underexposed, it's okay. But when you get to the overexposed, it's very difficult to see those very clearly or have visible, crisp lines, okay? Okay, so some key takeaways. Interpreting the film in detail before checking exposure. First, verify the patient, right? Utilize the RIPE mnemonic that I discussed, looking at rotation, inspiration, penetration, projection, and then exposure or artifacts. That's the RIPE mnemonic. That helps us to assess that the image is appropriate for interpretation. Avoid common mistakes of calling underpenetrated, hazy films as having a potential bilateral pneumonia or pulmonary edema when that is likely to be fake or false, right? Number two is assuming that a digital image is fine where you think you can adjust the contrast on the computer screen. That's not going to be reliable. Remember, poorly exposed image may have lost information, especially at the extremes, and the patient may have received more radiation dose than is needed. I hope that you found this topic genuinely helpful, right? And remember, this takes time to soak in. You have to get practice applying it also by looking at lots of x-rays and seeing the subtle variations. Our radiology colleagues, right, they're experts at this. But when they're not available to help, sometimes we have to make an assessment in right here and now. I don't have time to wait for a formal read. So if you found this to be helpful, please make sure to subscribe to our channel at YouTube and give us a like, share this with your friends, colleagues, so that we can continue to provide you this type of content moving forward. If you want ability to download some of the things that discussed in this particular lecture, you can get that at thisiswhy.health. It's for free. Downloads images for other topics as well, right? You get access to discounts to course prep material, ask questions, access playlist collections that allow you access to things that are not always found on YouTube. Lastly, if you want to put this particular topic about the exposure, considering RIPE, and the full picture of how to read a chest X-ray in its entirety in a systematic approach, check out my topic review where I teach you how to read a chest X-ray like a pro. Okay guys, take care, we'll see you next time.